Epilepsy is a seizure disorder that occurs when neurons are active at the same time. Typically, neurons will send chemical messages at varying times, but with epilepsy, many neurons fire simultaneously, causing a surge in electrical activity, which results in a seizure. There are two types of seizures: partial or focal, which only affects one hemisphere or lobe of the brain, and generalized seizures, which affects both hemispheres of the brain. There are also two types of focal seizures. Focal seizures without a loss of consciousness is when the patient remains conscious but senses such as the way things look and smell change, as well as their emotions. Focal seizures with impaired awareness is when the patient may stare into space and not respond normally to their environment, or perform repetitive movements such as walking in circles or rubbing their hand. Generalized seizures include absence seizures, characterized by staring into space and only last between 5 to 10 seconds. Tonic seizures cause stiff muscles and may affect consciousness, also causing patients to fall to the ground. Atonic seizures cause a loss of muscle control, and since it most often affects the leg, it often causes patients to collapse suddenly. Clonic seizures are characterized by repeated, jerking muscle movements, mainly in the neck, face, and arms. Myoclonic seizures usually appear as sudden, brief jerks that affect the upper body, arms, and legs. Tonic-clonic seizures are the most dramatic type and can cause an abrupt loss of consciousness and body stiffening or twitching. Anyone who has gone through a seizure does not necessarily have epilepsy. Epilepsy is diagnosed through EEGs or electroencephalograms, and they measure the electrical activity in the brain. CT scans and MRIs can also obtain images of a brain that reveal if there are any abnormalities, such as tumors in the brain or traumatic brain injury, that are causing the seizures, which helps to rule out epilepsy. The difference between epilepsy and seizures is that epilepsy is relatively unprovoked, while other kinds of seizures have underlying reasons. People with epilepsy can take anticonvulsant drugs, which help to control seizures. Depending on the patient's condition, they will be prescribed different kinds, which include carbamazepine and topiramate. Patients may also get surgery to remove a small part of the brain that is thought to be causing the seizures.